to tell me to do it. Good morning, guys. So welcome and happy Thursday. Can you see us here? Yeah. So today is career day, and we'll try to do one at the end of every unit. And so those of you that are at home, pay close attention. Those of you that are here are going to have fun. So the reason I asked Dr. Romanek to come today was because we just did skeletal, and we're going to have an exam next week. And we spent 3 weeks doing it. So they've learned a lot, and we still have a little bit left to go for content. But the reason I asked Dr. Romanek is I think it's so amazing to have the opportunity to see something applied. Do you know what I mean by this? So I'm the perfect personality for this when I was your age. My chemistry teacher in high school, Mr. Gustafson, I did not like his class. And because Mr. Gustafson never smiled, and I couldn't figure out why I was taking it. I mean, my counselor told me to take it, I took it. And I said to him one day, I don't know why we're learning this, and I forgot what it was we're learning. Salicylates. Okay, we were learning about the things that make aspirin and anti-inflammatory drugs. And I couldn't figure that out, how that was important to me in the future. And I said that to him sort of, and he just laughed. And his thing was like, you don't get like the foundation that we're trying to lay here for you so that you can use this chemistry later. This is not, I'm not here to keep you busy at school. Okay, so I understand that. I think it's always good to obviously draw the links between science and career. So that's what we're doing today. Oh, I know. Kenneth feels bad that he laughed at me. Well, I deserve it. Okay, so I'm going to talk just for a minute about careers in general and thinking about them. And then we're going to watch a video of a spine surgeon going to see a chiropractor. And I told Dr. Romanek that he gets to decide whether he likes the video or not. And he hasn't seen it either. So we're going to do that. And then Dr. Romanek, did you bring your questions?
I did.
Oh, excellent. So we have your questions that you handed in for Dr. Rom. And he's going to talk about, I don't know, probably.
Yeah, talk about a lot. And the questions give me a lot of things that I can go into. And
Think about.
Yeah.
Okay. So I'm going to put this down. Yeah.
I wrote my questions in Google Docs, but I didn't.
Oh, share them to me right now. Share them to me right now. Or do you remember what they are?
Yeah.
Okay, cool. So share them to me, and then when we get that far, just ask them in class. So that'll be good. And then, of course, you have a little bit of homework tomorrow. I'm going to talk about calcium regulation. How does your body regulate where it is? Whether you have it in your bones, whether you have it in your bloodstream, and what is the significance of that? And I'll just give you a little preamble. What? Say again. Loud.
The calcium.
Has to do, yes. So we're going to talk about how it's regulated, but I'll give you a clean example of how I would use that information. I used it yesterday. One of my friends called and said that her husband had lost 20 pounds without trying over the last month.
I love every time you say something like that, the first thing I think is cancer.
Okay, so I said he had a kidney stone a few years ago. He was having low back pain. He just was a little off. He didn't feel bad, but he wasn't eating. And she said, oh, something else really interesting. He got his labs back today, and his blood calcium is very high. And so Dr. Ram and I look at each other and we know exactly why that is. So tomorrow I'm going to explain that for you. Why did Dr. Ram and I look at each other and go, scary? So, but what undergirds our locking eyes on each other is the science that we took. And after tomorrow, you will know that too. So don't be missing tomorrow. Okay, thank you, Kenneth. And Kenneth, if you'll also like parse it, because I don't want to get on Google Docs right now, just when we get to the questioning part, go ahead and ask your question. So I just have a few comments about careers in general, and they're going to seem obvious, but Dr. Ram and I probably share a lot of these thoughts, having been teachers for a long time. And that is this. I'm gonna take this down just for a minute. I hate having a wet face. Careers require a plan. Period. And a decision, meaning if you want to, like Carson wants to be a physician. I don't forgot what Eugene, is it nursing?
Yes.
Okay, you're not sure, PA. Okay. None of this will magically happen to you if you are not intentional about it. And I know this seems obvious, but we have students that will get 3 years into college and their plan isn't working because they didn't have one. Or they missed a class. They missed a class that's only offered second semester, their freshman year. They didn't sign up for it, so it's not offered till the following year. So going to your counselor, your college counselor, and I want to add on the decision piece, which is a couple of you asked the question, did you ever feel like quitting? To Dr. Romanek. That's where this comes into play. This is true of nurses, this is true of doctoring, this is true of PT, this is true of pharmacy students. A decision is required, and it has to be one that you've really decided on. You've said to yourself, I am going to do this. Not, here's the opposite. You know, if it works out, you know, I'll do it. That you will not hit the finish line this way. So making a decision, getting your feet down on concrete, meaning I'm not wobbling on this decision. Okay, I have to retake a class. That's okay. I make my decision and I move forward. Just stating the obvious. The earlier you can prepare, the better. The earlier you can learn things like midterms, the better. The earlier you can learn to memorize, the better. So I just, and then also being very practical about money. Really looking at what things cost, looking for scholarships, looking for ways to go to school less expensively, but still get the same result. So a lot of students get taken in like, oh, we'll guarantee you into nursing school, but you're going to have $200,000 in debt when you get done. It's tempting, but there are other ways. So I just want to say, we'll talk about that. Health Careers talks about that a lot. And then be careful about your prerequisite courses. This means every professional school, like Dr. Romanek's med school, had a list of courses that they're not varying on. So say they required a class called Biology 240, and I took 220. When it comes time to apply into the professional program and become a doctor, they're going to be like, you need 240. Well, like 220 was just almost the same class, you say. They said, we don't care. It's 240. So be careful with counseling that you sign up for the right classes. It makes a big difference. Okay, good. That's my mom talk for today. Dr. Rom, do you want to add something?
I think, you know, to bring it right to where you are now, people, I ask my classes all the time, how many of you would like to get an A in my class? And every hand goes up. You know, every hand goes up. And then I ask this question, are you willing to do what it takes to get that A? And you know, people's actions speak louder than their words. Their actions show that they're not willing to do it.
Yeah.
Yeah.
So also students will say, am I smart enough to become a doctor?
And my answer is yes, because it's not about being smart. It's about, are you willing to do what it takes to become a doctor? That's it.
I think that's what all of our doctors say too. The kids that have become doctors in the program will say it is.
Hard
It's
work and
just work.
persistence.
It's just work. And it's not so much about, oh, am I brilliant and I showed up today and I know everything? No, it's not about that.
When I went to medical school, it became obvious very short after I got there that there were a lot of people, there were some people that were very intelligent. And I remember this one guy, we'd take our test and I'd get it, you know, I got A's on almost every test I took at medical school.
Yes.
But I never got a higher score than this guy. And this guy did not study. It just drove me crazy.
You hate him for it.
Yeah. But you know what? That was one guy.
Yeah.
out of a class of over 100 students.
Right.
Everybody else is studying
Yeah.
10, 12, 14 hours a day.
Yes.
Yeah.
Okay.
Just
that's
working
not-
hard. So anyway, you know, if your goal is to get 90% so that you can get an A, just know that that's too low. Your goal is too low. You need to make your goal higher.
Okay.
Okay.
I'm gonna show this video.
Oh, great, okay.
This is a spinal surgeon.
Yeah, I want to see
So
that.
this is an MD who did a probably 6-year residency or close in there, don't you think? 5 general surgery,
Oh,
1
yeah.
fellowship here. We were talking about that last class.
This will be very interesting.
And a lady chiropractor is gonna see him today, so that will be fun to see. Here we go.
How'd that feel?
Feels
Your
different.
head's still attached.
I recently put out a video about my thoughts on chiropractic medicine and received a lot of pushback from that video. So I decided to take it upon myself to visit a chiropractor myself to learn firsthand about chiropractic medicine and show you guys what it's like to be a chiropractor. You guys gonna check me out? All right, so we are here with Dr. Yates, who is a chiropractor here in Irving, Texas. Dr. Yates, how are you doing?
I'm doing great. Nice to meet you.
Absolutely. Thank you for having me today.
You're welcome.
Can you tell the viewers out there who you are and kind of what you do?
Sure. My name is Dr. Marilyn Yates, and I actually have a bachelor's degree in science, chemistry, and biology from Westchester University in Pennsylvania. And then in '96, I came to Dallas and ended up getting a Doctor of Chiropractic diploma from Parker University in 2000. So I've been a chiropractor for about 18 years now, and I love it. Well, basically what a chiropractor is we're a healthcare profession that works on patients that usually suffer from soft tissue injuries such as musculoskeletal system or nervous system. And we do all drug-free, hands-on manual therapies to help, alleviate the restrictions from the muscles and get some more mobility in the joints.
So excellent. As a spine surgeon, I'm always looking for ways to minimize a patient going to surgery. So whether that's physical therapy, acupuncture, chiropractic medicine, occupational therapy, I'm always looking for ways or different avenues for patients to seek care before surgery. And from what I understand, chiropractic medicine is a great way to exhaust everything that we can before surgery.
Yeah, it sure is. It's an excellent source because not only do we perform chiropractic adjustments here, as I mentioned, the manual adjustments, but we also offer passive therapy modalities such as EMS, electrical stim, and then we also do active rehab, as you can see in here too. And I personally also do a lot of deep tissue myofascial release as well in the patient, so they get a good, well-rounded program, and then I give them a lot of nutritional advice as well for home.
Excellent. So it's a collaboration between surgeons, between
Yes.
intensivists, and as a surgeon, I'm always looking to exhaust all non-operative measures before going to surgery, and I think this is an excellent, route to take before surgery.
Definitely, and vice versa, we work with surgeons as well, and we do the same. So if for some reason the patient is still not quite at 90 or 100%, then we'll work with a surgeon, refer them out, and we just basically work together to get the best care for the patients.
How long is the schooling for?
Nowadays, the school is about 4 years. Prior to getting into chiropractic school, you do want to check with each school, but on average, it takes about 90 credit hours of the basic sciences to get in. And then after that, we do have to take 4 board exams to graduate. And then depending on the state, you want to check with the state board. You do have to take a jurisprudence exam as well to practice and own the license to practice in your state.
And after all of that training, you become a doctor.
Correct,
Excellent.
yes. So you graduate in school as a doctor, but then to practice as a chiropractor, you do need to pass the jurisprudence
Excellent.
and the board exams.
So what is a typical day for you as a chiropractor?
Basically, the clinic here, we open at 9 in the morning and we have an hour lunch, so we're closed from 1 to 2, and then we're open again from 2 to 7. So Monday through Thursdays, and then on Friday, we're half a day. On average, I see about 25, 30 patients a day, so it's quite a bit.
Wow.
Yeah, so it
busy
gets
day.
pretty hectic, and then on Fridays it's a little bit lighter since it's just half a day. Yeah.
Okay. How much can a chiropractor expect to make?
It ranges. I know here in Texas, the average associate that comes in, it's about 48, 50,000, and then if you own your own practice, it's pretty much endless as a business owner, and so you can make anywhere from $102,000 to $200,000.
Another thing that's been really popular in terms of my channel and viewers and questions is adjustments, chiropractic adjustments. I'm a little nervous now.
All right, don't be nervous. I'm gonna loosen you up first. I'm gonna do a little massage, check your hips and your leg length, and then we'll get you adjusted, okay?
There's some people that don't really believe in the adjustments and other aspects of, chiropractic medicine.
So let's see what we got here. I'm gonna push down on your pelvis. So you're a little restricted right in here. Your hips are also rotated to the left.
I want to hear your thoughts, adjustments, like what are they and who should get them and when do you
That
do
too low
adjustments?
now?
That's a good question. So basically an adjustment is we're trying to alleviate the restrictions in the muscle tissue. So I'm just kind of decompress you a little bit. So I'm just kind of opening up your joints right here. Or it's called hypotonicity by using a hands-on. So the word chiropractor comes from the Greek language, chiro meaning hands and practo done, so done by hands. So we try to do the spinal manipulations or chiropractic adjustments by moving the joint, getting more joint motion in there, went way all the way up. I like to get you guys loosened up before I adjust you because it'll make it a lot easier for me to move the joints that way. Then when that occurs, then the muscles will start to relax and you get more blood flow, more nerve flow into the rest of the extremities and the legs and so forth. A lot of times when patients receive a spinal adjustment or a chiropractic adjustment, they'll feel better right away because they had so much restriction in them. We're all done with the exam.
All right.
Come on up. And as we alleviate that restriction, the endorphins get kicked in, so they also feel a little elated, especially in the neck adjustments. And so that usually will last about an hour or two if it's their first time. And so patients will have to come back for me to reassess them, and then we perform the adjustments again. And so it'll take about 5 to 8 visits before they start noticing a great change and the muscles start calming down and they get more motion in them.
I get this question a lot too in terms of popping your knuckles, cracking your knuckles. Is it okay to crack your knuckles?
No, and well, yes and no. Let me rephrase that. You want to extend the joint because everything we want to do, we want to lengthen. Okay, so if you do this, you're constricting the joint, and so you're actually causing or accelerating the arthritis in the joints. So you want to open. Also, we don't like patients to do this because that's usually a sign that they're tight and they probably need to come in. So it's a great chiropractic patients, especially here are motor vehicle accident patients because they have a lot of soft tissue injuries, but we also treat athletes. They're one of the best. A lot of professional athletes have a chiropractor they go to all the time to help loosen up the muscles and get more joint motion so they can be at their optimum performance.
And we spoke about utilizing all non-operative measures before a patient comes to see me for surgery. And before I send patients to a chiropractor for adjustments or for any type of treatment, I wanted to experience it and see what they're going through. So I actually wanted to try an adjustment today.
Awesome. I'm looking forward to it.
All right, let's do it.
Now recheck your legs. That's a lot better. Your heels are already leveling out, so that's good. So your hips are already starting to balance out. You're gonna feel me push.
He's wearing cowboy boots.
Drop. So I'm gonna come around and get the table set to your weight. Any pain? Good. 2 more. I'm also gonna adjust your sacrum right here. We're gonna tuck you underneath to open up that L5 S1 joint. tight right in here. Do you feel that restriction?
Yeah.
So I'm gonna adjust right this about T2, T3 area right here. I'm gonna tilt your head to the left.
Oh,
How'd that feel?
feels
Your
different.
head's still attached.
Yeah.
All right, you're gonna give me a deep breath in and out. On the out, I'm coming down with you.
Oh.
There we go. You okay? All right, you're just real vocal, huh? Let's flip over on your back for me. We're gonna stretch your neck out a little bit. Any pain or strain on this? Good. Tight one there and right there. So we're gonna start with the right side. So I'm gonna tilt your head and I'm just gonna give you a little tug. It already went. Did you feel it? Yeah.
Oh.
And then there we go. We just finished it off. One more. Right in here. Same thing. I'm gonna tilt your head and just apply a little gentle force in it.
Beautiful. That's really nice. You did a good job.
How you feeling so far?
Yeah.
So I just received my first adjustment, and thank you, Dr. Yates, for that. It actually wasn't too bad. I was expecting it to hurt a lot more, because I know in surgery we spend a lot of time like this right here, 6 to 10 hours sometimes in surgery. By the end of the case, my neck hurts, my lower back hurts, and yeah, I think it went well. What should I expect after this adjustment? Will I need another one, or how does that work?
Yes, usually you do, because on the first time you're gonna feel good only for a couple hours, and then because your muscles have a memory, they're gonna retract back to their old habits. So each time I work on you, we're gonna change that pattern, and then eventually after about 4 to 6 sessions, the body should start calming down. So tonight I want you to go ahead and drink plenty of water to flush out the toxins that we released, and then ice it down if it's a little sore as well.
Okay, and do you believe that prevention is key? Like some of the things that you were teaching me today, should I do these things at home to prevent further injury and, you know, further things from happening to me?
That's right, that's correct. So stretch, we talked about some light stretching exercises for home, and then of course some postural things too that you want to do. Since you look down a lot, you might want to take some breaks whenever you get a chance, and
okay.
do some shoulder rolls as well.
All right, thank you so much.
Okay. Okay. So I'm gonna manage the chat
In this video,
line.
I'm going to show you how to decompress
Oh,
your
no,
full
they're
back
not gonna
for
do that.
instant
Hold
pain
on.
relief. Stay tuned.
Hold on. And that's a no. There we go. That happens to me all the time. Okay. So let's move that. So, Dr. Ram, what did you think about the video?
I thought it was a good video, and I'm gonna say that the doctor, the surgeon,
Yes.
what's his name? Do you remember?
I don't remember. He's got a bunch of
yeah.
career videos
Yeah,
out,
I've
and
seen
he's
him.
just
I've
a
seen him before.
huge man.
And let me tell you, I have great respect for him for doing that,
Right.
because a lot of times people just don't do that. They
No.
won't. They have an opinion. They don't have anything to base their opinion on, and but they're gonna keep their opinion rather than find out. And that was great. I will say her explanation and the way she practices, I think, is a little different than I did.
Okay.
Actually, quite a bit different. Not that I didn't do what she does, but that is I'll say her explanation is the modern day chiropractor. It's not the chiropractor, the historic chiropractor. And while chiropractic does incredibly well for patients in just what she talked about, we've lost a whole part of our profession in helping patients. And I could tell you, I'll do this very briefly. And,
I'm good. You do whatever you want to do.
2 years ago, I went to a national convention because I was on the state board, the Oregon Board of Chiropractic Examiners, and the national board was having their convention. And while I was there, there was a presentation by a Dr. Cleveland. And Dr. Cleveland, there's actually a school in Kansas City called Cleveland Chiropractic College. And actually, they also had a college in Los Angeles, but they've taken everything and consolidated it to their Kansas City campus. But he was telling me, I said his parents, the school was actually started by his grandparents. That's how far back it goes. And to make this, his presentation was an hour and it was so good. But to do this for you in just a couple of minutes, he talked about how in the old days, when we go way back, chiropractors, there weren't licensing laws. And the doctor here, Dr. Gates, she mentioned that you have to take 4 national board exams to become licensed. And so every doctor, whether they're medical doctor, chiropractic doctor, dentist, they have board exams, and you have to pass your board exams to become licensed. It's not enough to just graduate from school. Anyway, when we go way back, there weren't licensing laws in the States, and so chiropractors were practicing without a license.
Wow.
And they would be arrested for practicing medicine without a license. And Dr. Cleveland, you showed these pictures of people who would go to the jail and they would demonstrate outside the jail demanding that
Wow.
their doctor be released. And here's the thing. They didn't just treat musculoskeletal conditions. See, when he asked her what they treat, she said musculoskeletal. That's not where chiropractic even started from. It didn't even start there. It's evolved into that. And we've let insurance kind of lock us into just that. And that's very unfortunate. We don't have people going to the jail. Of course, we don't have people going to jail for practicing medicine without a license, but people aren't demanding that their chiropractors be allowed to treat them for things other than musculoskeletal. So that's just a little historical thing there, okay? So a couple of things. Where should I start?
Well,
There's so much.
You know what?
Well, let's start with this.
There's tons.
start with
There's so much that you could talk about.
So Mrs. Ellis asked me to consider talking about a shoulder situation. And so
Because
that's
I have one.
That's what I've done here, okay? So this is as we look at this, and I'm assuming, oh yeah, okay. So here's the skull. And right down here is the occiput. Right? And this is all stuff that we've gone over
Yeah,
in class, right?
yeah.
So I'm not telling you things that you don't know. And so then here are the vertebrae in the cervical spine, and I'll put one more right here, just so that we see that this is T1.
So we
Okay?
haven't learned the names of the vertebrae.
Oh, okay,
Okay.
okay. So the vertebrae in the neck region, they're called cervical vertebrae, and cervical is cervical pertaining to what? The cervix. And cervix just means neck. Okay. So that's what we have here. There's 7 bones in the neck of all mammals. Okay. So we have 7 bones here. Now, the vertebrae protect the spinal cord. And the spinal cord has what we call spinal nerves that come off the spinal cord and they go out to the body. Okay, spinal nerves, and then they become peripheral nerves. And notice that we have 7 bones. So this would be called C1. And let me just put a C here. That's how it's usually referred to, because we don't want to say cervical 1 all the time. In medicine, we like to shorten things when we can, okay? So this is cervical 1, 2, cervical 2, cervical 3. This also has another name. Is it okay if I give them the other name?
Do whatever you want.
Okay, this is also called the atlas. And atlas comes from Greek mythology. And there was this god, Atlas, and Atlas, the Greeks always depicted Atlas as holding the world on his
Oh,
shoulders.
yeah.
And so C1 holds the world or holds the head on it. Okay. And then this one is called the axis because of its anatomical shape. There's a process on it called the dens or odontoid. Both those terms mean tooth because when they looked at it, and see, this is, I tell my students all the time, the anatomists were so great. They had such great imaginations. They would look at things and they say, that looks like, and then they would name it that. So there was this process, there's a process on C2 that is called the dens, as in dentist, see,
Mhm.
or odontoid, which means both those terms mean tooth. And C1, when we turn our head, C1 turns around it. So this is the axis of rotation. That's
So
what I
is
mean.
that like when their book talks about a pivot joint?
This is definitely a pivot joint.
Okay.
Yes, definitely a pivot joint. So now, in relation to this shoulder situation, and let's say in this situation, we have a loss of motion. And so we would say range of motion because we have a range that we can move joints through. Okay, so we have a restricted or reduced or lost range of motion. And sometimes it gets in the shoulder, we get this thing that sometimes we call a frozen shoulder. And the person's shoulder will be very restricted.
So Ron, just before you go too far, I showed them this on me. So
I showed them, okay, so see my left arm, we looked at this.
Oh, boy. Yeah.
There's
Yeah.
my right shoulder. That's what he's talking about, guys, in terms of range of motion. So that's not normal. Can I just say, that's as far as I can go, right there.
What can you do this way, the other way? What
I can do it really good this way.
Is that it?
That hurts.
Yeah. How about the other side? Oh, okay. All right. So when, yes,
And how did that happen?
So such a great question. And probably, so I've been saying that in our office, Eugene. I've been saying like, I don't know how this happened. And Dr. Romanik's desk is right there. And he's probably thinking, I know how it happened. Okay, I don't know. I don't know. And my doctor asked me the same thing. She was like, well, how did this happen? I was like, I don't know. Doctor,
Does it happen on the muscles or?
that's why I asked Dr. Romanik here.
Yeah.
To talk about, because I want you to see his brain. And when he's looking at someone like me, and I'm going like, they said, did you fall down? Did you lift something really heavy? No.
so what I don't have drawn here is, so here we are, and I put the clavicle here because the clavicle comes out to the shoulders. Here's the humerus, and the humerus makes a joint with a process on the scapula.
Ah, George.
So from the posterior, and if I use that term, is that okay for everybody?
Yes.
I know Mrs. Ellis has taught it.
Posterior, they know what this is.
Okay, so from the posterior, we can look at this, and here's our scapula, here's the humerus, and here's the humeral head. And the humeral head makes a joint with this process on the scapula. And that joint, and here I can show it here from the anterior or from the lateral, that process in there is called, I always call it the glenoid fossa. That's how I learned it. I think the author of my book that I use in my class calls it the glenoid cavity. I don't like calling it that because it is a fossa.
So we haven't learned those yet. And so guys, here's the other thing I want to say about anatomy. Okay, so if you think of anatomy as like a street map, okay, what Mrs. Ellis has taught you is all the freeways, like where Washington Square is, where the schools are, but I have not taught you, like, essentially, Dr. Romanik's starting to talk about where are all the little driveways and where does this cul-de-sac go? And that's what his section of anatomy, the next step up, is learning more of the little streets and the little detail of the human, the fossas.
So notice here on the board, I put anatomy, I put physiology, I put medical, anatomy, physiology, terminology. You must know, if you want to be in healthcare, you must know your anatomy, you must know your physiology. And it might be that you will specialize in a certain area of that, okay? But in the beginning, you have to know it all generally, and then you'll get to specialize as you go on. But you see, when you know your anatomy, you know anatomy terminology. When you know your physiology, you know physiology terminology. And that is part of what makes up medical terminology. So just make a decision now. Wow, this is so great. Make a decision that you are going to love studying anatomy and physiology, because I can guarantee you, it's the first thing you have to take when you go into the health professions, studying the health profession. Very first thing. And it's very often very intense, all right? All right, so we have this. Now, around this, right here is a muscle, and that's what I've drawn here, and it's the deltoid muscle. You haven't done muscles yet.
Starting next week.
Okay. So I'll just tell you, this muscle, again, the anatomists are so great. They looked at things and they said, that looks like, and they said, this muscle looks like an upside down Greek letter, delta. And oid means like. Oid means like. So they said this muscle is delta-like in its shape. And it's upside down. And really, what is a delta? The delta. The delta is just a triangle. But now we take this, and here's how it is. It's this way. And the base wraps around. The base wraps around the shoulder here, inserts or originates off of the clavicle and off of the scapula. And then inserts right. They've got it inserting right here, right there, okay? And there's a little bump there. Wherever there's bumps on bones, something is going into it. In this case, it's a muscle, and that's called the deltoid tuberosity. All right, now back to this loss of range of motion. So the patient comes to me, says, doctor, look, on this side, I'm great. On this side, I'm like this. On this side, I can do all of this. On this side, I can only do this. All right, so here's what I'm going to do. I'm going to ask the patient, have you ever had this before? Yes or no? Okay. Have you ever hurt your shoulder? Now, see, do you have any recent injuries? See, everybody thinks about, did I hurt myself recently? But they forget about the injury they had 20 years ago. So did you have an injury sometime in the past? That's very important. Tell me about surgeries you have. I've never had surgery to my shoulder. Have you had any other surgeries? Well, yeah, I had surgery here, I had surgery there, or I have had no surgery. So we need to know about those, okay? And what activities have you been doing recently? Maybe we haven't hurt ourselves, but we've been doing something. In fact, just this very morning, I was out here in the hall talking to a teacher. And the teacher was wearing a brace. And I won't say where or anything like that. Anyway, I asked the teacher, did you hurt yourself? No, I haven't hurt myself. Didn't have any injuries. But, well, what have you been doing? Well, I've been doing XYZ. And so as a result of XYZ,
I've been shoveling like 200 loads in a wheelbarrow.
yeah. And see, here's the thing. When we think of an injury, we think I'm walking along, I step on the side of my ankle, on the side of my foot, and I sprain my ankle. And we call that a frank injury. But what about the injury that comes from, get this, overuse? You see, no, I can't point to this day that I hurt myself, but I've been shoveling
Yes.
and
And the
shoveling.
other thing I want to say, and you have the same problem, Dr. Romanek, is above my neck, my body thinks that I am the same age as my brain thinks I'm your age.
Yeah,
So my brain feels exactly like it did when I was younger, which is, I can do that.
yeah, exactly,
Of
exactly.
course I can do that. That's not a problem. But then sometimes it's a problem
Yes.
because I can't really do it.
So next, here's what I'm gonna do. Next up, here's what I'm gonna do. I'm gonna ask, have you had any, because this isn't, there's some conditions that this relates to more than others, and the shoulder, for some reason, this relates to. And have you had any emotional ups and downs recently? Because for some reason, emotions seem to affect the shoulder.
What?
Yeah, yeah.
What?
Especially the frozen shoulder kind of thing.
No way.
Yeah. So I need to know that.
Yes,
Okay.
Eugene, what do you want to know?
I think you're too happy, so that's why your shoulder hurts.
Oh, you think I have too much happiness?
Yes.
So I have one thing I want to ask you, Dr.
Yes,
Romanek.
yes.
I have an extra feature that's weird. Like my deltoid on this side. Okay, when I put my hand on my deltoid on this side, it's soft. Okay, it feels like it's just flat. On this side, it has these bands,
and cords,
cables.
yes.
Oh my gosh. It feels like there's a rope running down the middle of my arm.
We're gonna get into
Okay,
it.
good.
Okay. So then the last thing I want to know about, well, not last, but for our discussion, have you had any problems in your neck? Okay, now this is very neurologic, it's very osteopathic, it's very chiropractic. It might not be as much allopathic, and when I say allopathic, I'm saying MD, but even the MDs would be all over this, especially the neurologists. Any problems with the neck? And here's the reason why. As we come and look at the neck here, the deltoid is, I could really get into a lot here, and I'm going to try and keep it simple.
Try to like pare it down.
The deltoid muscle is supplied, its main supply comes from C5. So C5 is the main, we call it a motor neuron because motor means to move. It is the main motor supply to the deltoid, and it tells the deltoid when we want it to contract. So, all right. So all of that is going to help us. Now, maybe all the answers to my questions aren't all that helpful, but my exam and just the range of motion, I mean, that's a lot. So to help you know, when we put our hand behind our back, we call that internal rotation, because in anatomic position to get see how I had to turn my arm? See how I have to turn my arm this way? I'm rotating it inside or internally. So we call that internal rotation, and we would measure that, and I would say how much I believe, in this case, Mrs. Ellis, is how much range of motion she's lost. Then when we go here, this is just lateral or abduction. This is abduction away from the body. But then when I reach over like this, that's external rotation, okay? External rotation. So I would measure all of that and I would record it. Because of this, I'm gonna do a nice exam on the neck and record ranges of motion. And I'm going to palpate. Palpate means put my hands on the patient And I can do all kinds of things with palpation. I can just feel the muscles, these cords that are here. I can do muscle testing, which I did a lot of. In other words, when I want to abduct my arm, I put my arm to the side. First, I want to know if the patient could just do it on their own. Then I'm going to resist them. And in the first 6 inches, because of this muscle, you see, a muscle, here's its origin. Here's its origin, and I'm putting this in blue because on the skeleton, whoops, I did that wrong. What am I doing? This should be in red. Origins on the skeleton are painted in red, and insertions are painted in blue.
So
here's
could you
our
explain
insertion.
the difference too?
Yes. The origin is nearly always closer to the torso. Nearly, I won't say 100%. And the insertion is usually farther away, more distal. When the muscle contracts, it pulls the insertion towards the origin, and that's how we get movement. Okay?
So Emily, if you're listening, you asked that question a couple days ago, and I told you we'd get to it. So that is, Dr. Ram is answering that. And here's another thing, I just want to step in and say this at this point. I hope the person that asked me, why does it take so long to become a doctor, is starting to get it. Because who knew that Dr. Ram had this all in his head? And here's the thing I want to say about Dr. Ram. Dr. Ram did not understand this on a weekend. Like he didn't like study a book on a weekend and was like, oh, good, I'm a doctor now. This is just one injury, one specific injury that we're looking at. And the very reason that I asked him to come, he is accomplishing, which is this. Why do I have to study so hard to be a doctor or a nurse? Why? And the reason is because there's hundreds of injuries like this. And so when Dr. Romanik's looking at me or anybody with a shoulder injury, his brain is thinking about my nerves, my back, my neck, my muscles, my previous injuries. What would mean if this happened? What would be if that happened? And he's sorting silently in his brain like a giant sorting hat, like, and it's leading him to think about diagnostics. And I just want you to see that, because a lot of people think doctors just memorize lists and they're like, oh, it's this. No, it's like a giant mystery game every time you get a patient in front of you and you're solving the mystery yourself. A cure for boredom, right?
Absolutely.
Okay, just
I'm
saying.
just going to put 2 words here.
Yes, art and science for sure.
And we don't hear much about art anymore in health careers or in the health sciences, but the art of practicing is, how do I apply this? How do I look at the patient and apply the science that I know? And it's so important. Okay, so important. I will say this. When you are a healthcare provider, there's 2 things you need to keep right here all the time. One, it is a great honor, great privilege to have people come to you and ask you to help them. And the second thing is, it is a great responsibility. It's not, and Mrs. Ellis talked about this, it's not, oh, they came to me, I'll give them a half effort and send them on their way. No. Each patient is a special person. They deserve every ounce of your expertise. And if you find yourself, you're in the health professions, and you find yourself not able to do that, or it's becoming difficult, I think you should leave. Because the people are precious. That person that you're working on is somebody's mom or
Yes.
dad or son or daughter.
Or Graham.
Yeah, that's a different thing. I think when I see like someone, for example, I see the news and someone died. For me, it's like, well, it's not very important. But then I think that's probably like, that could be like my mom or like my dad or my sister.
Right.
Or that's somebody's
Yeah.
sister or family, and they are like very upset upset right now. So yeah,
And sometimes I've said to nursing students, Eugene, what would you, when they're trying to make a decision about what to do for a patient, I say, what would you want for your mom?
yeah,
What would you want for your sister? She's not your mom or sister, but we need to treat them that way. It's such an excellent point. Parsa.
And doing doctorate or we have to in the art sector we have to be creative for everything.
Such a great question.
Oh,
Such a great question, Parsa. Parsa wants to be a physician.
yeah. You know,
Did you guys hear the question, Eugene, Kenneth? No, I don't think he
I
can
have a
hear.
question related to that.
take just a second.
One second,
We'll make sure
Kenneth,
everybody hears
did
the
you hear the question?
And then-
I can't hear him. I have to turn it down too low. Okay, no. So Parsa, one more time and then I'll repeat it.
In doctoring for surgery and some after your medical school and you have to be creative for
Uh-huh.
every situation for every problem that someone has.
Okay.
This is a particular
Okay. So Parsa's asking about, once you're trained, so say Dr. Ram does all of his undergraduate, gets a bachelor's degree, goes off to chiropractic college, does 4 years of that, takes his 4 tests, all of it's done, and then he's licensed. Parsa is asking about, are you creative? Like, is there a creative element like to doing diagnostics? Is that what you're asking in treatment? Or is everything laid out for you? And I think that is one of the questions that students have a misconception about most commonly.
And so it is a great question, and I'm going to tell you one of the worst things. And I'm going to answer your question, and I'm going to preface it with this, which actually helps to answer. One of the worst things that's happening in medicine right now are algorithms.
Yes.
And these algorithms say that if the patient has this, you do this. If you do that, and then the patient has this, you do this, and that eliminates all creativity, all art. It's all here, and it's a cookbook, one size fits all, and it's the worst thing that could happen to healthcare. Doctors need to be able to individualize their care, and I feel super strong about that. And this is something that I fought against while I was on the board. Unfortunately, I was in the minority opinion, and because people want, people want everything to be just this, and that's not the way it is. It's just not that way. Because
Humans are
people
not that way.
Special. People are individualized.
Yeah.
And so to answer your question, yes, you must be creative to be an excellent doctor. And that takes me back to another word we never hear in healthcare at all anymore. You see, I've been licensed for nearly 40 years. And I started school over 40 years ago. And you used to hear this word all the time and you never hear it. You never. And I'm going to tell you, healthcare will never be as good as it could be until this comes back. And that's this word here. I'll put it up here nice and big. There was a time in healthcare when doctors wanted to be healers. They wanted to restore their patients to great health. Now, the emphasis is symptoms and the elimination of symptoms, which does not, never think that the elimination of symptoms equates with health. There's two different things. And, some doctors, you see, when I started this term, you heard this term a lot from the naturopaths, from the chiropractors. You even still heard it from the osteopaths. The osteopaths, I think, have lost it completely because they've gone the way of allopathy. And chiropractors, they're losing it. And naturopaths, I've had naturopaths come and speak to my students, and you wouldn't even know they're a naturopath. You wouldn't know. You wouldn't know from what they say. Hopefully, Mrs. Ellis' son works in an office, and she tells me some of the things they do, and they are wanting to be here.
Yeah.
It's so wonderful.
And I'm going to say what
It's so
the difference too of what he's saying is what you see commonly in cookbook medicine, where Parsa and Eugene and Luz wants to be a PA. This will come. Lupe will totally come into your life is the patient comes to Dr. Romanek and they say, oh, well, I've seen 3 other doctors and all of my lab work looks good and my x-rays look good, but I feel terrible. So that's the difference, where a physician that is in the healing arts will say, well, you're not supposed to feel terrible, right? We're supposed to feel good. And so a lot of people say, well, the patient's 80, they're supposed to feel bad. No, they're not. And so I think that is the other big change and I think what Dr. Ram is saying is have a personal mission that requires a decision. This is the kind of practice I will have. And you see it in teachers, anybody who works, you'll see those that have made a decision to be excellent and those that have made a decision to get a paycheck. There's a very big difference in those two things. And I want to have a paycheck, but I also want, my bigger goal is to have the paycheck of seeing my students do well.
Yeah.
That is my paycheck. That's my big paycheck.
It's always your parents telling you should become a plastic surgeon because they make good money.
Yes.
But yeah, they're not going to be the people that's going to spend 13 years studying something that you only are going to study because of the money.
Yes. Money is not a great long-term motivator. It's nice, but it does not equal fulfillment. So, okay, Dr. Ram, I want to have the kids, I want to get a couple of their questions in.
Sounds great.
This is a practical one.
Yeah.
And this is from Luz. Can you tell us some of the strategies you use to memorize medical terminology? Such a good question.
Yeah. Well, first of all, I'll tell you, when Mrs. Ellis and I went to school, and we went to school about the same time.
Yes, we did.
We didn't have classes in medical terminology. You learned your medical terminology by learning your courses, whether that was anatomy, physiology, medical terminology, physiology, pathology. That's where all the medical terminology is there. And by using it, you learned it. But that said, the thing I try to encourage my students to do is use the terminology that we use. Don't take, if we say humerus, and now I ask you to do an assignment or you're working in your study guide, don't say arm, say humerus. Use the terminology and use the terminology
That's a good point.
in class and with your classmates and with your teacher. And then to really, anatomy is a lot of memorization and recognition. Physiology is a lot of understanding. But anytime you have to memorize something, and we've been told, oh, you shouldn't ask the students to memorize. Well, I'm going to tell you, if you don't memorize anatomy, that's what anatomy is. Right? Seeing a structure and knowing what it is. It's repetition. It's just repetition.
And when you
repetition.
learned these things, Dr. Ram, when you were their age or a little bit older, and somebody said you got to memorize 100 things, and a lot of it has to do with learning style. So I don't know Dr. Ram's learning style particularly. I could guess, but what activities did you do when you were trying to drill that into your frontal lobe and hold on to it?
Here's what I would do. I'll tell you, when I went back, I taught school on Friday, and on Monday I went back to start my pre-med at the University of Washington.
Oh, that's cool.
Yeah. And I walked into my first class, 8 o'clock in the morning in the summer quarter. And there's my professor, and I'm going to tell you, he's one of the greatest professors I've ever had. And it was a physiology class. Here I am. I was a history major. I'm walking into a physiology class. It was a 300 level physiology class with physiology majors. And here I am, the history major, and I've got to go in there and take this class because it's a prerequisite.
That would be scary.
It was. And the first day, he starts drawing a cross-section of the spinal cord and a reflex arc.
Mm-hmm.
And you talk about scary, I'm telling you, I was intimidated. I left that class, and so it's summertime, so if it was a regular quarter, the class would have lasted an hour. In the summertime, it lasted 2 or 2.5 hours every day. I went from class, I had some time before my next class. I went to the library, I pulled out my paper. And you know what I did? I drew and drew and drew what he drew in class. And at first, I had to look at it and draw it. Then I turned it over, drew as much as I could, labeled as much as I could, then turned it over and completed it. And I'm not kidding. I did that for several hours. And I'm going to tell you, I did that for several hours. When it was time for me to go to my next class, I had it. Now, I had it in the short-term memory, right?
That's why we draw in here all the time.
I had it in the short-term memory. Did I have it in long-term? Well, when I came back to it that night, I wasn't where I started, but I didn't have it in long-term memory, so I did it again. I'm telling you, repetition is the way to go, and drawing is, because you're using all these senses. You're seeing, you're using kinesthetics,
and your brain also, when you draw something, as opposed to look at flashcards, your brain takes a picture of it. And so you're taking a test, you're taking this long multiple choice test, and my brain would flash on what I'd drawn. And so if you ever have to take a memory test, like there's a really interesting memory test that doctors give in an office where they'll say, I'm going to give you 10 words. And I want you to, I'm not going to talk about them until the end of our appointment. And at the end of the appointment, I want you to tell me what you can remember. So my son, who's a physician, has patients that are in their 90s. And they'll be like, I'm not going to be able to remember it. I'm so worried. And he'll say, no. Here's how you pass it. In your mind, you pick your favorite place, the beach, and you put out a beach blanket. And in your mind, and you put all the objects that I'm telling you on the blanket and have a good look at them. And your brain will take a picture of it, and you'll get 3/4 of them easy. You have to have the creativity and the way to, link it into your memory. And it is there, 1% of the population, I'm going to say, don't have to do that. Every physician you see had to do what Dr. Ram's talking about. Just again, more practice. Yes, Eugene.
That really happens to me. Like, for example, like if I try to memorize the word, it's like a bunch of words. It's difficult, but then I see the word, and it's like my brain takes the picture.
Cool.
And then I can I have it here.
It's so cool. And so what I'm saying is, guys, a lot of times you'll get students. Do you guys know the children's book? Probably not. Chicken Little. Okay, so Chicken Little is a little chicken, and Chicken Little's problem was what? What was his problem?
It was too small.
He was too small, and he was afraid. He was afraid of everything. So it'd be like, so I will often say, like in our office, Paula, you're being a Chicken Little. She'll be like, oh, baby, this is going to happen, and that's going to happen. Okay, that turns off the part of your brain that has the pictures. So if you can make a student practice also of being like, okay, I know I don't remember this right now, but I know I have it in my brain, and I know I have a picture of it somewhere. Einstein said the average human uses 5% of their brain power. 5%. Parsa.
What is the best major to?
Oh, excellent question. So Parsa's asking, what is the Yes. Parsa is asking, what is a good major for a pre-med? Is that your question? Okay. Okay. So there is a book, Parsa, called, and I can probably find a copy for you that we have, called Barron's Guide to Medical School in the United States. Buy it on Amazon. And the answer to your question is, it depends on the school. So, and I'll just give you some examples. So like Baylor University, really famous university in Texas, there are 7 full-size hospitals on the Baylor campus. It's huge. I think they have 55,000 undergraduates. All right. Baylor loves biology, biochem, zoology, etc. Contrast that with Washington University in St. Louis, Missouri. University of Washington is in Seattle. Washington University is in St. Louis. Great question. So Parse is asking about majors. Washington University loves you to be a French major who took all the science. You still have to take the prerequisite courses. So he's asking, what major should I be? If you were my son, just to be honest, what I would coach you to do is to become a science major undergrad, like biochem, chemistry. One of my kids loved chemistry. I don't know why. I told her she wasn't going to like it, and then she did. So I think you should pick something you like. Do you want to talk about that? Under what best degrees for doctors?
Well, I think, from what I've seen, the great majority of candidates are some kind of a science major. And it's become very popular in recent years. See, in the old days, it was just everybody was a biology.
Yeah, that's right.
Everybody. What's your major? Biology. What's your major? Biology. What's your major? Biology. Even when I went to school, everybody was biology, except me. And it's become very popular to go into biochemistry, which is another biology. But the thing about that over just biology is it's considered much more difficult, a much more difficult major. And so they seem, at the school where I have helped, they seem to like those kinds of things. But if you like science, I'd go into science. But I'm going to tell you, if you don't like science,
Right.
I don't think you need to. I'll tell you just real quickly. The first day I was at medical school, we were in our meeting, and this person is talking to us and talking about what majors had the highest percentage accepted to medical school.
It's a great question.
And the reason she did this is because of complete surprise. The highest percentage of people accepted to medical school had a music major. Now, here's the reason why.
A lot of docs are musicians.
Yeah, and here's the reason why. There's only a very few music majors who apply.
Oh.
There's all these biology majors that apply, and they can't all get accepted.
No.
So by far, if you take who's in school, by far, it's nearly 100% biology major. But when it comes to applications, it's a smaller percentage of those biology majors that actually got accepted that year. Are they going to get accepted the next year or the next? Probably, because they're going to reapply. But so that was interesting, and that really, it made me feel good, because here I was a history.
Yes.
And
I think did they ask you when you interviewed, did they ask you about that? So did they say, hey, Ron, why are you a history major? So I think sometimes it works in your favor.
Absolutely.
Because the schools will say, like, oh, this is actually not just a robot we're interviewing that decided they wanted to become a doctor. This is like a person who has a passionate interest in this. Because one of the things they're also looking for now, especially interviewing young doctors, is, are you a healthy person? Can you make it through med school? Do you take care of yourself? Do you have good self-care?
That was important in the interview. My major, nobody asked me about it.
Oh, interesting.
I don't know, but how are you going to make it through medical school? That was asked.
Several
different
people
ways.
have that question, just so you know.
Yeah.
How did you make it? Was it worth it? How did you take care of yourself? And Davis wants to know what your favorite snack was, because Davis apparently, we talked about how much he outweighs me, but he wants to know, like, some personal things about strategies about self-care, and how did you make it through?
Well, okay. So, one, you don't get sleep, or I didn't. I had to study hard. I just had to study hard, and without making this long, I'll tell you because we're out of 45.
We have 3 minutes.
Oh, I'll tell you quickly.
But you can come again.
Yeah, I didn't have enough money to pay, and I couldn't borrow enough money to pay for my education. And so I had to work, which is a big no-no. In fact, if they ask you in an interview, do you plan on working? And you say yes, that, I was told that would have been an automatic checkoff that they would not accept.
Wow.
And I was concerned about that because I knew I was gonna have to work, and had they asked me, I would have been honest with them.